James Davis.
Thank you, Chair. Just a couple of questions. Ivan Olbrechts, if you don't mind. I was speaking to a self-advocacy group for those with learning disabilities in my constituency back in October. And of course, there's a pandemic currently, but isolation was one of the key issues that came through as a problem in terms of what was articulated. Now, when you look at the locked wards, the 96 or so across the country, I'm aware that many of those within those facilities are many miles away from home. Can you give us an idea as to how far away currently some of those patients are?
I can't explain how far some people are, but what I would say is it's never in somebody's best interest to be a long way from their families. I think the courts will usually pick up the clinicians at some point after some sad event around that particular issue. But I just fail to see how it's ever in somebody's best interest to be a long way from home. And everybody's saying the same thing here. It's loud and clear, as it was in the Transforming Care programme, that the provision needs to be closer to people's homes. Otherwise, it's just not community provision.
Understood. But there are people on the opposite side of the country, for example, is my understanding.
Absolutely. But I don't have sight of that.
No, fine. I've seen Julie and Vivien both nodding, or I think Vivien possibly wanted to come in.
Yeah, so I just wanted to say that, so we're supporting families where their relatives are placed long distances from home. And so that means that not only is the person sort of picked up and put somewhere into an unfamiliar environment by people that don't know them, but also that their families struggle to maintain the contact that they want to maintain, and so often travelling, for hours and hours to visit their relative, and then they come up against other barriers. So, for example, we've supported families who've travelled for hours to go and see their relative. And their relative, they will get there, and the service will say, "Well, he's having a bad day. You can't come in and see him today." So they are denied access to that. Conversely, lots of families are told that if they do go and visit their relative, when they leave, their relative is upset, understandably, because they want to be with their relative. So the relative is upset, and therefore their behaviours escalate, and therefore they try and restrict the visits to families. And so at a time when it's really, really important that families are involved and engaged and seeing their relatives and advocating for them and providing all that love, care and support that they do, that it's very, very easy to restrict that and try to cut families off from their relatives.
Julie.
Yeah, I just want to put that one on its head. I mean, most of the time, in 4 of the 5 hospitals Jamie was in, he was actually quite close to home, about 45-minute drive. So that meant I could visit him every day. I could go and see him every day, and I took him out every day for a couple of hours. We'd go to a farm because he likes the animals. We'd go out for a Costa. We'd go shopping to buy him some stuff for the ward. We were out and about in the community, no problem. He had a great reputation, a great relationship with the lady in the local Starbucks. And that was just me and him out and about in the community for a couple of hours each day. And then you go back on the ward and I'd be getting reports of restraints and over-medication, and he'd been in seclusion that morning and whatever. So I think that just goes to show the usefulness of being close to home. If I hadn't been able to do that, I wouldn't have been able to work as hard as I could to get him out. I wouldn't have been able to work with him to provide strategies that made it easier for him to cope and get out, because the staff just couldn't do it. And he might still be there. He might still be in hospital. There was talk about him being sent to secure wards and all sorts. And yet the fact that I was able to take him out every day by myself with no problem whatsoever actually just proved, to my mind, just how wrong the hospital environment was. So it goes to show there, we put that on its head, the usefulness of being close to home and having that regular family contact.
Indeed, yeah. And Dan, we've heard about Italy, but in terms of what already exists in this country, can you point to areas of good practice? I understand there's a specialist hospital being constructed in the Mersey region, for instance.
That's right, and there are huge concerns about that. Which is, we had a service model published by NHS England back in 2015, along with the Building the Right Support strategy, which very clearly stated, what should be developed, around high quality local support services, and what's being developed on Merseyside is not in line with that. Right. And many of us, have been asking, serious questions around why that's being allowed. Why the Care Quality Commission are willing to register a service which doesn't comply with the service model, because it's not what we want to see develop, and it goes completely against the direction of travel that we've had for the last 10 years in terms of trying to not support people in settings far away from loved ones, from family members, where they're at increased risk of abuse and neglect if families can't regularly visit and find out what's going on. And we want people to be part of their communities, and that won't allow for that.
Right, that's very disappointing. So even the latest developments not meeting demands or needs as you would see them in any respect.
No, I mean, I think there are major problems that, a number of independent providers have been able to significantly expand their inpatient provision under existing regulation of those services, because CQC isn't able to stop expansion under an existing service license. And that's a major problem. The Commission needs to have robust powers to stop that kind of expansion, and to actually make sure that we deliver, the specification that was set out in the service model 6 years ago by NHS England, which everyone supports, around development of local services. So you're absolutely right. In many cases, things are actually going in the wrong direction, and new large services are being built, which are completely against the service model.
Right, and Vivien, finally, sorry.
Yes, I just wanted to support what Dan has said, but also to highlight the role of commissioners, because commissioners are buying places in the wrong sorts of places, the wrong model of care, and so they have a huge role to play in commissioning the right community support to meet individual need, rather than purchasing places in the wrong model of care, where there are vacancies, and I think there are huge concerns around the lack of accountability. That it's not a they don't have a professional body, they don't have code of conduct or standards, and there's no accountability. So I think there are over 2,000 people still in inpatient units, but someone is paying for those beds, and those are commissioners who could be commissioning alternative provision. So I think there's a range of issues. We don't want people building units, because if they build them, people will buy beds in them. But then we need all parts of the system to work properly. We need providers not to build the wrong services. We need Care Quality Commission not to register the right services, and we need to commissioners not to buy places in services that are harming people.
Thank you.
Thank you very much indeed. Did you have any more, James?
Well, I was just aware Julie had her hand up again, but otherwise not. Thank you.
Okay, Julie, you come in, and then I'll move on to Barbara Keeley.
Yeah, sorry, you can't stop me when I get going on this. I just wanted to let you know that, and you probably already know, that talking about the law and legal changes, we have a huge amount of law that is already completely disregarded by authorities, public bodies, commissioners, everybody. For example, the Care Act already requires commissioners to provide the right kind of support and in the community, and to shape the market so that that's provided. So there's already a legal requirement. It doesn't happen. So I think, and all the other laws that get disregarded, the Equality Act, the Human Rights Act, aspects of the Mental Capacity Act, the Mental Health Act, Children and Families Act, there is a huge disregard for the law already out there. And I think that we need to find a way of holding people to account when they don't obey the law.
Thank you very much indeed.